Hello everyone, my name is Kayla and I'm here to inform you about a new and dangerous disease that is spreading extremely fast. I'm sure you all have heard about it. It is a new disease called Ebola. Ebola is a very dangerous and uncurable as of now and is spreading extremely quickly. Ebola is a known deadly disease and it is very important to know the facts about it. Not many people are aware of Ebola and what the actual disease and dangers are, but Ebola is a deadly virus that originated in parts of Africa and is now traveling its way to the United States. It is also to be known as the hemorrhagic fever. Ebola causes bleeding inside and outside the body. As it spreads throughout the body, it damages the immune system and the organs. Basically, this leads to severe, uncontrollable bleeding, and the disease is known to kill up to 90% of the people that have been infected. This virus can be transmitted through the bodily fluids. Some ways to become in contact with the virus is touching infected patients without proper methods of protection and caution, or touching contaminated needles or surfaces. Symptoms of Ebola include high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, and lack of appetite. Symptoms will start to show anywhere from 2 to 12 days after the infection, and as the disease gets worse, it can cause bleeding inside the body as well as from the ears, nose, eyes, and it is known that some people can vomit or cough up blood. Ebola is a very serious, deadly, and contagious disease and can be hard to be diagnosed from just the symptoms. If you are found to be infected with Ebola virus, you will be immediately isolated and put in a quarantine to prevent the spread. Now, it is important to know the origin of the Ebola virus. Even though the first case of Ebola was found in 1976 and this year's 2014 outbreak, more than 8,900 people from African places have been diagnosed with the Ebola virus, and out of those 8,900 people, more than 4,400 people have died from it. But on September 30th, 2014, the CDC announced that Thomas Duncan, who was a Liberian national, was diagnosed with the Ebola and brought it back to Dallas, Texas, then passed it on to his nurses Nina Pham and Amber Joy Vision. Healthcare workers seem to have the highest risk of catching Ebola virus. It is important to the healthcare providers that are aware of the health guidelines and that they are provided with the correct equipment to care for the patients and know the proper way to use the equipment, especially when dealing with the patients that have potentially had the Ebola virus. According to the article Infection Protection New CDC Ebola Guidelines Stress Gear Ritual by Maggie Fox from NBC News, Thomas Frieden, who is the CDC director, said anybody who is going to work with them is going to be trained and demonstrate in anything they are going to be putting on and taking off. Second, no skin may be exposed when personal protective equipment is worn. In conclusion, it is important that our health caregivers are protected correctly, since it is their job to protect our patients. Ebola is a very dangerous and uncurable as of now and is spreading extremely quickly. Ebola is a deadly and scary disease to be diagnosed with, and a cure is just waiting to happen. Thank you.